Gallstones or cholelithiasis in medical term. Gallstones are solid deposits that form inside the gallbladder, a small organ located under the liver. The gallbladder stores bile, a fluid produced by the liver that helps digest fats in the small intestine. Gallstones can vary in size and composition, and they can be made up of cholesterol, bilirubin, a waste product, and other substances. When the bile in the gallbladder becomes too concentrated or the gallbladder doesn't empty properly, the substances in the bile can form crystals that eventually grow into gallstones. The two main kinds of gallstones are 1. Cholesterol stones. These are the most common type of gallstones and are usually yellow-green in color. They are made up of hardened cholesterol that has accumulated in the gallbladder. Excess cholesterol in the bile can lead to the formation of cholesterol stones. 2. Pigment stones. These stones are smaller and darker than cholesterol stones and are made up of bilirubin, a waste product that is produced by the liver. They can be black or brown in color and are more common in people with certain medical conditions, such as liver cirrhosis, biliary tract infections, or hereditary blood disorders like sickle cell anemia. Other less common types of gallstones include mixed stones, which are a combination of cholesterol and pigment stones, and calcified stones, which are hardened calcium deposits. Causes of gallstones. The exact cause of gallstones is not fully understood, but several factors can contribute to their development. These factors include excess cholesterol. When the bile in the gallbladder contains too much cholesterol, it can lead to the formation of cholesterol stones. Impaired emptying of the gallbladder. If the gallbladder doesn't empty completely or often enough, the bile can become concentrated, increasing the risk of gallstone formation. Bile imbalances. The bile contains substances that can prevent the formation of gallstones, but if these substances are imbalanced or deficient, it can increase the risk of gallstone formation. Obesity. People who are overweight or obese are more likely to develop gallstones. Gender. Women are more likely to develop gallstones than men, possibly due to the effects of estrogen. Age. Gallstones are more common in older adults, particularly those over 60 years of age. Family history. If other members of your family have had gallstones, you may be at a higher risk of developing them as well. Certain medical conditions. Certain medical conditions such as diabetes, liver disease, and Crohn's disease can increase the risk of gallstones. Overall, a combination of genetic and environmental factors can contribute to the development of gallstones. Symptoms of gallstones. Many people with gallstones may not experience any symptoms and may only discover their gallstones through imaging tests or other medical procedures. However, if the gallstones cause a blockage or inflammation in the gallbladder or bile ducts, symptoms can occur. The symptoms of gallstones can include 1. Abdominal pain. The most common symptom of gallstones is sudden and intense pain in the upper right side or middle of the abdomen, which can last from several minutes to several hours. 2. Nausea and vomiting. These symptoms may accompany abdominal pain and can be severe. 3. Jaundice. If a gallstone blocks the bile duct, it can lead to jaundice, a yellowing of the skin and whites of the eyes. 4. Fever. If the gallbladder becomes infected or inflamed, fever can occur. 4. Clay-colored stools and dark urine. A blockage in the bile duct can cause these changes in stool and urine color. 5. Indigestion. Some people with gallstones may experience indigestion, bloating, or discomfort after eating fatty foods. Seek medical attention if you experience any of these symptoms, as untreated gallstones can lead to serious complications such as infection or inflammation of the gallbladder or pancreas. Gallstone diagnosis. There are several methods used to diagnose gallstones, including ultrasound. This is the most common and preferred method for diagnosing gallstones. It uses sound waves to create images of the gallbladder and can detect the presence and size of gallstones. CT scan. A CT scan can provide detailed images of the gallbladder and surrounding organs and can help detect the presence of gallstones. MRI. An MRI can also provide detailed images of the gallbladder and surrounding organs and can detect the presence of gallstones. Blood tests can detect elevated levels of bilirubin and liver enzymes, which may indicate a blockage or inflammation of the bile ducts caused by gallstones. Endoscopic retrograde cholangiopancreatography or ERCP. This is a more invasive procedure that involves inserting an endoscope through the mouth and into the small intestine to visualize the bile ducts and remove any gallstones. If you are experiencing symptoms of gallstones, your doctor may order one or more of these tests to diagnose the condition and determine the best course of treatment. Gallstone treatment. The treatment for gallstones depends on the severity of symptoms, the size and number of gallstones, and the overall health of the patient. Treatment options include 1. Observation. If you have small gallstones and no symptoms, your doctor may recommend observation and lifestyle changes to prevent further gallstone formation. 2. Medications. Certain medications, such as ursodeoxycholic acid, can be used to dissolve some types of gallstones. However, these medications may take several months to work, and gallstones may recur after stopping treatment. 3. Surgery. If you have symptoms or complications from gallstones, your doctor may recommend surgery to remove the gallbladder, a procedure known as a cholecystectomy. This is the most common and effective treatment for gallstones and is usually done laparoscopically, using small incisions. 4. Endoscopic procedures. In some cases, an endoscopic procedure such as ERCP may be used to remove gallstones from the bile ducts. 5. Shockwave lithotripsy. This procedure uses shock waves to break up gallstones so that they can pass through the bile ducts and out of the body. 6. Percutaneous cholecystostomy. This procedure involves placing a tube through the skin and into the gallbladder to drain bile and relieve symptoms, particularly in patients who are too ill to undergo surgery. Your doctor will evaluate your condition and determine the best treatment option for you based on your individual circumstances. It's important to follow your doctor's recommendations and attend all follow-up appointments to monitor your condition and prevent complications. Complications of gallstones. Gallstones can lead to several complications if left untreated, including 1. Inflammation of the gallbladder or cholecystitis. This occurs when a gallstone blocks the cystic duct, causing the gallbladder to become inflamed and infected. 2. Blockage of the common bile duct or cholelithiasis. This occurs when a gallstone moves from the gallbladder and blocks the common bile duct, causing bile to back up into the liver and leading to jaundice and other complications. 3. Inflammation of the pancreas or pancreatitis. This occurs when a gallstone blocks the pancreatic duct, causing the pancreas to become inflamed and painful. 4. Gallbladder cancer. Although rare, long-term inflammation of the gallbladder caused by gallstones may increase the risk of developing gallbladder cancer. 5. Biliary colic. This is a severe pain that occurs when the gallbladder contracts against a gallstone, causing sudden and intense pain in the upper abdomen or right shoulder. 6. Infection. In rare cases, a gallstone can lead to infection in the gallbladder or bile ducts. Can gallstones go away on their own? Gallstones cannot go away on their own. Once they have formed in the gallbladder, they will remain there unless they are treated or removed. However, some people with small gallstones may not experience any symptoms and may not require treatment. In these cases, doctors may recommend a wait-and-see approach to monitor the condition and only recommend treatment if symptoms develop. Although gallstones cannot always be prevented, there are certain lifestyle changes that can help reduce the risk of developing them, including maintaining a healthy weight, eating a healthy diet, avoiding rapid weight loss, exercising regularly, drinking plenty of water, and avoiding or limiting alcohol consumption. It's also important to manage any underlying health conditions, such as diabetes, that can increase the risk of developing gallstones. If you are at high risk of developing gallstones, your doctor may recommend regular screening and monitoring to detect any potential issues early.